Hello everyone, today's video is about H. pylori. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it, so thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So someone recently posted on one of my other videos saying, am I planning to do a video on H. pylori? And I said, I'll just do one. So sure, here's the plan. Here's the video. So with H. pylori, I mean, to be perfectly frank, I find that in a majority of cases, patients can be effectively treated for H. pylori using the standard sort of medical model for addressing H. pylori. So, typically taking a couple of antibiotics, taking a proton pump inhibitor, basically just, kind of buying some time for the stomach by suppressing the acid production and killing off the infection, and that's all there is to it. So it's usually, it's not one of those types of infections where it's like, oh, it's oftentimes like very resistant to treatment, or there's like this huge pool of patients that have treatment-resistant H. pylori or something like that. It's not like chronic yeast issues or chronic Lyme or co-infection issues or things like that, which those can also be effectively treated in many cases just using standard medical approaches, but not really as much of a world of chronic H. pylori issues compared to some of those other conditions. With that being said, there are certainly cases that are very recalcitrant to treatment, recurring cases, and then I do have some patients, I have had patients over the course of time where for various reasons they just do not want to use any pharmaceutical medications. Either they have been allergic to certain antibiotics and they're afraid to have an allergic reaction to another one, excuse me, or they just really strongly prefer not to use pharmaceutical interventions. So for various reasons, I've had patients who have chosen to pursue non-pharmaceutical management of H. pylori. So I'll just kind of speak to all of that. In my experience, for the patients who have just really hard to treat cases of H. pylori, or quite frankly, the protocol I use is the same for the patients, whether it's hard to treat H. pylori or it's folks who just prefer not to pursue pharmaceutical treatment for H. pylori in the first place. Generally, the things that I recommend for my patients when they're dealing with one of those scenarios is trying to work with the most the most stomach-friendly diet possible. So it's just trying to steer away from foods that tend to be more aggravating, such as like citrus fruit, spicy foods, foods like coffee. Coffee is generally, in my opinion, quite a healthy thing to consume in inappropriate amounts, but it can be a little bit hard on the stomach. Sometimes folks need to be mindful of like a lower histamine diet when they're dealing with H. pylori if they have pre-existing histamine-related issues, and then just trying to eat healthy, trying to minimize their intake or avoid, refined sugar, trying to keep, gluten or dairy products to a minimum if patients have issues with those types of foods in the first place. So trying to have a diet that's gentle on the stomach, and then also trying to minimize food sensitivities is important in many cases. What I also find to be very helpful, and it's kind of like the in a way, kind of like the non-pharmaceutical version I guess version of a proton pump inhibitor, even though it's working through a completely different mechanism, is using demulcent herbs. There's this really great formula that I like. It's made by a company called Designs for Health. I have no financial affiliation with Designs for Health. There's other companies. There's another one here. It's a Canadian company called the Nutritional Fundamentals of Health, or NFH for short. They make a very similar product. So the Designs for Health product is called GI Revive. The NFH product is called GI Relief. I think it's called GI Relief. Shoot, now I'm forgetting. We haven't stocked that one in a while. It's usually the GI Revive, but sometimes they get back ordered. And there's actually quite a few other products out there that are quite similar. I can't think of any of them off the top of my head, but if the person is thinking like, oh, I wonder if the product I'm taking is similar to GI Revive, just go on the Design for Health website and see if it's similar. But there's quite a few products now. Actually, I probably see maybe half a dozen that are quite similar to those. I really like the GI Revive one. It has DGL in it. It has aloe extract in it. It has marshmallow root extract in it. It has a little bit of quercetin, which I don't really think is actually therapeutically important for the formula, but it just happens to be in there. It's got some zinc carnosine in there. It has some glutamine in there. So it has a number of different ingredients that have a soothing effect on the stomach and the intestines as well. It's kind of my go-to formula if a patient's saying like I have gastritis symptoms or have intestinal irritation, intestinal pain issues, kind of like gnawing pain, I find that formula tends to be quite effective at helping to mitigate those symptoms. So I'll usually bring something like that into the mix, and then I'll work with antimicrobial herbs as well. I really like oral essential oils for killing off microbes in the intestinal tract, especially like in the the upper gastrointestinal tract. But essential oils can be quite irritating to the stomach, so I usually tend to steer away from those. I tend to focus more on herbs that are in an encapsulated form, like a dried herbal form, like wormwood, black walnut, grapefruit seed extract. Berberine can be effective. Mastic gum can be effective for H. pylori. There's actually research literature looking at licorice extract, not deglycerinated licorice, but just regular old licorice extract with the glycerotinic acid in it. You have to be careful with that because it can have a blood pressure raising effect in folks who are susceptible to that. So those are typically the herbs that I'll work with. And for folks listening, you might be thinking like, those are herbs that are used for yeast overgrowth, fungal overgrowth, maybe large intestine bacterial overgrowth, maybe a little bit of overlap with small intestine bacterial overgrowth. And absolutely, one of the wonderful things with herbs is that a lot of them can be quite broad spectrum in their activity. I tend to dose the herbs fairly high, and as per usual, I'm not able to give out any dosages over social media, but just generally speaking for reference, the dosages that I would typically use would be kind of like around 50% to maybe 100% higher than what I might recommend for, say, treating intestinal issues. I find H. pylori can be kind of require a little bit of a heavier-handed approach. So I guess the practical implication of me mentioning that is if a person listening to this is suffering with chronic H. pylori issues, not really getting the results that they're looking for, working with a clinician who's helping with natural health products or whatnot, or non-pharmaceutical treatments, or plus or minus pharmaceutical treatments, you may be talking to them about like, am I taking a high enough dose? That's sometimes a factor that needs to be considered. But in my experience, I found that to be quite a successful approach. I mean, to clarify, I don't have every patient taking all of those herbal antimicrobials, but those are just kind of the pool of herbs that I might draw from. But usually it's a combination of berberine, the wormwood. There's a formula that we work with here called dysbiosis formula. It's wormwood, grapefruit seed extract, and black walnut. So it's usually that plus some berberine, the GI Revive for the soothing effects on the stomach, and then being mindful with the diet. And that's usually an effective treatment strategy in my experience. Sometimes we do need to switch things up. Quite a lot of good research on mastic gum. I've had patients who come in on mastic gum. It's just not something I usually prescribe directly myself. Just we have other formulas that we have kind of easier access to, but mastic gum, I've had other patients come in where they've been prescribed that by another clinician, or they self-prescribed it, and like, yeah, just knocked my H. pylori out of the park. So it's something that is worth mentioning, just not something that I typically recommend in my own practice. We kind of find the tools that work for us, and if it ain't broke, don't fix it. But if I lost access to berberine or the dysbiosis formula, I would strongly consider getting some mastic gum to replace those. So that's about it for H. pylori. If the person asking the question or anybody else has any further, more specific questions about H. pylori, I'm more than happy to answer those if I'm able to. Just post in the comment section below. But otherwise, I will leave it there for now.